RPOCs. Often in an ultrasound report, you see this diagnosis called RPOC. RPOC stands for Retained Products of Conception. So let us discuss today on my channel, myself Dr. Jyoti Mishra, gynecologist by profession, talking to you about RPOCs. Whenever this report is there and it comes to us as a doctor, we ask the patient about has she recently delivered a baby, or she had a recently miscarriage, or she has gone for abortion by choice. In any of these situations, a small part of pregnancy or the placenta by which the baby's cord is attached to the mother, any small membranes of the placenta may be left behind. A small piece also is called an RPOC. One condition is she has to recently deliver a baby, or she has had a miscarriage or an abortion. These three things are a must. What are the symptoms of RPOC? How do you identify? Patient doesn't know that she has RPOCs. Her common symptom is irregular vaginal bleeding. So she may continue to bleed, heavily bleed, spotting may continue, or she may have other symptoms such as fever, pain in lower abdomen, for which she may see the doctor. Most of the time, doctor examines the patient and sends for an ultrasound which shows us an RPOC. How do you confirm that it is an RPOC? We send the patient for an ultrasound. Ultrasound may show just a small mass inside the uterus. Now, to differentiate this small lesion which is being shown from a blood clot or from some abnormal types of pregnancies is also very important. So, a blood clot may not show color flow on color Doppler, whereas an RPOC not always, but most of the times will show a color flow. So, differential diagnosis is still there, and it cannot always be 100% differentiated from other causes of this mass which is showing on the ultrasound. So how do we confirm? Any tissue which is of suspicion, the final diagnosis is when you see it under the microscope in a lab. How is RPOC treated? The treatment can be expected that we just allow the patient to have her next menses. This is possible only if she is not heavily bleeding and the size of that tissue is very small. So you can allow her to wait for some time and let the periods come and the mass may get flushed out. The second possibility is medical management. We give certain drugs are available which can make the uterus contract and allow it to expel the mass which is lying inside. But none of these are 100%. So we counsel the patient that it may happen that it may not expel the mass fully in one go. The third treatment option is surgery. Surgery used to be DNC. DNC means cleaning the uterus. People would go to a doctor and they would just clean the uterus. Most of the time the tissue would come out, but sometimes because you're not looking inside, you're doing a blind procedure, you're just putting an instrument and cleaning it, scraping it. Sometimes the tissue may be left stuck behind. And nowadays we are seeing so many cesareans, so on the cesarean scar, if the tissue is stuck, it will be densely stuck. So by simple blind curettage, it may not come out. By blind cleaning, it may not come out. And these are the cases where you need hysteroscopy. So let us discuss the role of hysteroscopy for RPOCs. Hysteroscope, as discussed in many of my videos, is putting in a telescope inside, looking at the uterus on a large screen where you can see every nook and corner of the uterus and seeing where the tissue is, on which wall it is stuck, the anterior, the posterior or the side walls, and how deeply it is stuck. So you go and cut only that part and remove the tissue rather than scraping all the walls of uterus. Why is it not right to scrape all the walls? Because this is a young lady. She wants to have children in future. By scraping all the walls, we don't know how much depth we are scraping. We may lead to some conditions like cutting too much of the inner lining, which may invite adhesion formation later on. Adhesion means forming, making the walls to stick with each other. So these are the patients who come later on that my periods have become very scanty. I had RPOCs and doctor did DNC, she cleaned my uterus, and gradually my periods have become very scanty. So here we start thinking of adhesions. Adhesions means those curtain-like structures which make the uterus walls thin and stuck to each other. So these are the patients who may require further treatment, further surgeries. Let's not go to that detail right now. So my say is hysteroscopy definitely has a major role. It is an evolving role of hysteroscopy in RPOCs, where the doctor looks inside and cleans only that part which is stuck, leaving aside rest of the inner lining of uterus without damaging it.